At your direction, this country has worked hard over the past few weeks to ramp up ventilator production through all means possible. Thousands of ventilators are coming in now, monthly, with over 100,000 by the end of June. At the same time, there are over 60,000 ventilators in our hospitals right now that are not in use. Knowing this, and at your direction, we reached out to the American Hospital Association to design a system that allows hospitals to lend ventilators to other hospitals right when they need it. Within the past week alone, 20 top health systems have signed up for this dynamic ventilator reserve, representing over 4,000 ventilators. Not only do we have top academic systems like Cleveland Clinic and Mayo Clinic, but we also have top health systems from New York City, New Orleans, Washington State, and California. Over a week ago, these places would have needed help, but now they are here to help. There's been no American that has needed a ventilator that has not received one. This dynamic virtual reserve, combined with our strategic stockpile, will ensure that this is always the case. I'd like to thank the President for his leadership and directive to focus on public-private partnerships like this one. I'd also like to thank Sam Hazen from HCA, Lloyd Dean from Common Spirit, for leading this effort with the AHA and the Federation of American Hospitals. These have been difficult times. A few weeks ago, the Vice President came into my office and he reminded us of the power of the resilience of the American people and of private companies. We needed it that day, Mr. Vice President. This partnership is another example of Americans helping Americans.
Thank you very much, Mr. President. We appreciate the opportunity to work with you and your team on the Dynamic Ventilator Reserve Program. This will provide a really important mechanism for us in serving our patients and communities by ensuring that this vital equipment will be available to critical areas that are in need. You know, as this battle against this disease has affected the country a little bit unevenly, the rates of infection, hospitalization, and ICU use varies from one region to another. In some places with lower infection rates, some ventilators may not be in use, while other areas are potentially stretched beyond their capacity. The database of available ventilators that we are creating will allow us to flex so that we can make sure that available equipment can be shared with those in need. We appreciate the leadership of the health systems that are here today that has stepped forward. And Adam mentioned a few. I don't know if he caught Dr. Fritz Francois from NYU Langone and David Dill, the CEO of LifePoint as well. We appreciate the work of the administration in helping us find innovative solutions to ensure the best care for our patients. We'll continue to work with hospitals and health systems across the country to add to this reserve further. Your team has provided us with important leadership, and we look forward to working with you in making this a success. Thank you, Mr. President.
Thank you, Mr. President, Mr. Vice President, Adam, the team. I stand here before you in front of our 285,000 colleagues who provide care to patients every day across the country. One of the guiding principles we had when we went into this COVID-19 battle was to find partnerships with other components of the industry, partnerships with other health systems, but partnerships with governments, both local and federal. And we're proud to be a part of this private-public sector partnership, and I think it's going to do great good for the community. So thank you very much.
Thank you, Mr. President. It's great to have Ochsner Health be part of this program. We certainly have been a recipient, and the state of Louisiana has been a recipient of help getting ventilators to our state and to Ochsner Health. We're currently taking care of about 60% of the COVID patients in New Orleans, and we did see a spike over the past few weeks, but we're starting to get on the other side of that and heading in the right direction. I also want to thank you personally for helping Ochsner Health. A couple weeks ago, we were running short on surgical gowns, and you and your team were able to direct some to New Orleans, which was helpful to us and other hospitals around the New Orleans area. So we're excited to be part of this dynamic ventilator reserve, and we are proud to be part of that and help other communities around the country. Thank you.
Thank you, Mr. President, for the invitation here. On behalf of the Cleveland Clinic, I would just like to offer a slightly different story about the COVID pandemic. In our home state of Ohio, with an early institution of social distancing, our ability to scale up the testing and ramping out the capacity, we have actually seen a stable number of patients over the last 8 to 10 days. Only 160 patients have been hospitalized with COVID infection in Cleveland Clinic Health System. We are also very grateful for the support from our state government as well from our federal government. This is a battle where we're all in together. We coordinate our efforts, share our resources, and work together as one. I'm firmly convinced that we can do a lot of good when we work together. Thank you very much for having us. Thank you, sir.